we're happy to have Dr. Walter Sartor, who is with the PNS Surgery Center, to talk about bariatric surgery. Dr. Sartor, thank you so much for joining us today. And I think a lot of people are interested in this because I understand there's a lot of misconceptions about bariatric surgery.
There are a few, and we've been, since 2008, transforming the lives of over 700 patients with the sleeve gastrectomy. We've had a lot of concerns and questions that patients have when they come to see us, and we'd like to kind of dispel some of those myths while we're here.
What are some of those myths?
Well, one of the myths that people think that they need to be 100 pounds overweight in order to have the surgery, and it's not at all necessarily true. Patients who have medical conditions such as diabetes and hypertension, if their body mass index is 35, which more translates into 65 to 70 pounds overweight, they still qualify for the surgery. There's a myriad of medical problems that are associated with obesity, and patients with lower BMI still have those medical problems, and they qualify for the surgery. There's even literature out there that suggests that patients between body mass index of 30 and 35 are still acceptable candidates when they have these medical problems.
What do you have to say when people say, oh, this is an easy way out to lose weight?
It's not an easy way out because it's a surgery.
So you're right.
You know, it's very difficult for a patient to lose weight on their own. Mm-hmm. There's a lot of genetic factors and metabolic factors that fall into obesity as a whole, and so people try to lose weight and have very difficult times, not because they fail, it's because they're genetics. And changing the way the patient's metabolism works, or actually changing the way the stomach communicates with the brain, which is how the sleeve gastrectomy works, enables these patients to get a leg up on their weight problem and get it under control. And so an easy way out, no, it's a surgery, there's recovery, there's adapting to a different way of eating, and it's a lifelong adjustment that you have to constantly be vigilant about. The surgery is not a magic bullet, it's not a cure, it's a tool to enable the patient to get control of their weight. And the surgery will pretty much get you there, but it's up to the patient to stay there. So you have to adhere to this. Now, in the long term, Louisiana Center for Weight Loss Surgery does have this total lifestyle care program that enables patients to have access to counseling, and whether it's psychological or nutritional counseling, and I'm available as well. And so we try to take care of the whole patient.
What are the risks?
Overall risks. With any surgery, there are risks. The overall risks currently are not a whole lot worse than any other type of general surgery, like a colon resection or something like that. And this is a big myth with weight loss surgery, is that it's so risky. 20 years ago, 25 years ago, bariatric surgery was almost kind of like a black box. Nobody really understood how it worked. The techniques were open surgery, have to travel somewhere to have it done, and the patient was sent home to follow up with their primary doctor, and not a whole lot of information. We know so much more about the physiology of obesity and weight loss surgery now, and the instrumentation and operative techniques are so much better that we've really brought the risks down substantially. We participate in a national database in our program, and we have a center of excellence called the Metabolic and Bariatric Surgery Quality Improvement Program. And you have to jump through a lot of hoops to get that status, and we're really proud to have that designation. The literature shows out there that patients who are done in centers of excellence have fewer complications and tend to do better. They have more follow-up, more aggressive follow-up on the long term, and so I think that's what sets us apart from a lot of programs.
Okay, and Dr. Sartor, where can someone go? Where would you suggest someone go to get more information?
You can call our toll-free number at 1-866-821-LIVE or LIVE, or you can call my office 318-398-2984.
All right. Well, thank you, Dr. Sartor, so much for coming on and talking about these myths. And we'll be right back after these messages.
All right.